Good evening, everybody. I'm Dr. M.R. Vichandra. I am here to shed light on the recently declared fungal epidemic post-COVID. So far identified fungal infections are black fungus, white fungus, and yellow fungus. As said by Dr. Guleria sir, better to identify fungus by their scientific name rather than by color. Their scientific names include mucormycosis for black fungus, candida for white fungus, and nanisopsis of ascomycetes for yellow fungus. Previously, this yellow fungus is identified in PL HIV, that is people living with HIV and AIDS. Okay, and these fungal infections have been around for many years. The conventional risk factor for these fungal infections are high blood sugar, which is more than 500, random blood sugar, and ketosis. Ketosis is nothing but the blood sugar in the absence of relative deficiency of insulin. It will be converted to ketone bodies to feed the brain and heart. Acidosis has many types. One is secondary to ketoacidosis, and renal failure, hypoxia, which occurs mostly in the hospital setting. And this high ferritin is nothing but it's a storage form of iron in the body. When there is inflammation in the body, the ferritin is released from storage form to the circulating form. The released circulating ferritin will be used for killing the bacterial cells and the human body cells. So when there is increase in the iron, free iron in the body, some fungus like mucormycosis, which are siderophoric means the growth will be rampant in high iron states. There may be increase in the growth of such fungus. Immunocompromised states like post organ transplantation, people who are on long term immunosuppression like some rheumatological disorders, okay, and people with immunosuppressive diseases, congenital deficiency of phagocytosis, or it's like people living with HIV and AIDS. There are so many immunocompromised states which are risk factors for the rampant fungal growth, but we have never seen these fungal infections occurring along with another pandemic in such large numbers so far, right? So there might be unidentified new risk factors like unhygienic masks, unsterile water in the humidifiers, maybe leaky oxygen cylinders. Some are even saying high zinc supplementation coupled with irrational immunosuppression could also be a contributing factor. So scientifically, if you don't have at least 2 or 3 risk factors, there is no need to panic about these fungal infections. And also spread of the fungus and severity of fungal infections varies widely in the human population based on the phagocytic activity of neutrophils and mucosal immunity factors. So kindly be vigilant about the new symptoms after third week of COVID, at least for a month, and there is no need to panic. Early symptom of any and every disease will be mild. Take proper precaution. When in doubt, seek a trusted medical advice. Thank you.